Hello everyone, it's Dr. Tim Newton with Inspire Movement Physical Therapy. In this video, I'm going to talk just a little bit about our mechanical approach to dealing with TMJ pain. Often the type of patient that we see that is coming in with this complaint is somebody who's been dealing with it for a long period of time. This person may also have headaches, popping and clicking in the joint. They've been told not to clench when they're stressed, and they've also been told that it's a psychological problem. And very often in rehab, that's where things stop. And it's sort of left to you as the patient to figure out what you need to do to psychologically fix things, which is a very hard position to be in. We like to look at the TMJ from a mechanical standpoint. We remember what the J is in TMJ. It's the temporomandibular joint. And it's a joint that is actually very much like the knee. It's a hinging joint, all right? And we are focused on the health of the movement there. So go back to that example of the knee. If your knee cannot straighten all the way, and it cannot bend all the way, you know that you have a knee problem. We want to make sure that it can get full excursion through that range of motion. All right, we want to make sure that the mobility is as optimal, symmetric, and pain-free as possible. So that's our approach, and that's what we're concerned with. When we're talking about what dictates how well and how far the jaw opens, the TMJ that is, we are very concerned with the ligaments and muscles of the joint. So in treatment, very often, we will go and do intraoral techniques, right? That's pushing on the muscles inside the mouth to get them to loosen up and release. So this could be something for the masseter muscle, which is a clenching muscle. It could be something that we do for the pterygoid muscles, which control protrusion and retrusion of the mandible. We can also just go and try to stretch the joint itself. Now, these aren't great forces that we're using, but for the TMJ, it's very powerful, and you feel the difference as a patient. So we do work on the muscles of chewing, that we call that the muscles of mastication, and we work on stretching the joint out a little bit. But we also need to remember that the TMJ is part of the head and neck complex. So treatment to the segments of the cervical spine, that's the neck, is also very, very important. Neck muscle tension plays a very big role in our bite, and we don't really think about it. But if you take your teeth, your front teeth, and bring them down, touching them lightly together, and try to maintain that light touch while you move your head around, you'll feel the teeth shifting on each other. That's just one little example to show you the effects of subtle changes in head position on the bite. Now imagine if you have a chronic neck tension on one side, think of what that has done to shift your bite. It's something that adds up over time, and it's part of the puzzle that we always want to look at. We may even want to do a craniosacral assessment to see if there is cranial tension that also needs to be addressed, or it could be part of the headaches. So that's how we look at it. That's how we look at how well things open. We're also looking for good symmetry and reduction of pain in that. But let's also talk about the closing. That's the other half of it. If you came to me for a knee problem and I said, gee, you can straighten it out great, but your bending isn't very good, you still wouldn't be satisfied. Same thing for the TMJ. The health of that joint depends on how far you can open and how well you can close, right? Both of those matter. The closing happens when the teeth touch. So the bite is a very important part of this puzzle as well. And very often we're working with a dentist, your dentist or a TMJ specialist, to try to get that bite just right. And this could involve the use of a nighttime appliance to make sure that when the teeth touch, the TMJs are in the right position and right muscular balance. So that's a very important part of the equation that we don't want to leave out either. In the meantime, before you ask your dentist about getting a nighttime appliance to help with this, you could just buy something from an athletic department or over the counter. You could get any kind of athletic night guard. Shock Doctor and Doctor's Night Guard are brands that I recommend. And it's just a moldable plastic. You put it in the boiling water, you take it out after 10 seconds, put it on your teeth, bite down, and there's just something about having something in there to bite down on that helps to decompress the TMJ. It can really help with the pain there and maybe even headaches. So that's a place that I usually advise people start with, and we work on getting the bite better with the dentist, and we on our end work on neck tension and tension in this area. And it's that back and forth, and we're just getting the system more and more loosened up, normalized, and in less pain. So that's the approach. It's holistic. We're looking at everything, but we also are paying attention to what causes what and the motion in the joint. We don't believe that it's all in your head and it's all a stress thing. This mechanical thing is a very important thing to address in TMJ pain.